Shut up, man.
My name is Lejean And Jahirul, and today we will be going through treatments and rehabilitation of the posterior cruciate ligament, which is located in the knee at the back. So here's the back of the knee, and the posterior cruciate ligament is at the back of the knee, so it runs from the femur bone down to your tibia bone. So that's the ligament there, and a complete rupture is this diagram here. So that's when the ligament tears, basically. What is the PCL?
The posterior ligament is located at the back of the knee. The main function of the posterior is to keep the tibia from going back to the femur, so it doesn't go all the way to the back, and it stops it from rotating to the side, so you can't turn it.
Signs and symptoms. Pain during the time of impact. So, say for example, a player came into me, for example, head on, like it would cause the ligament at the back to snap. So you see the pain there. You also hear a pop at the time of impact once it snapped, and your range of movement would also be minimal. And the posterior jaw test, that will test how severe your tear is, basically. And initial treatments.
First, you would apply rice when you first receive the injury. Then you see a sports injury specialist, and then they will go through with the test and find out how severe the injury is. Like they'll do the posterior jaw test. Is when they put your leg on the table, and there's the specialist will move your tibia, your lower leg, back and forth, and see how far it goes to see how bad the injury is. You have the Lejean's test, which is when the examiner puts your thigh on his leg
Underneath.
yeah, and try and move the lower leg to see how stable your joint is or how severe the injury is. You do then you go for the MRI scans and see. And if the injury is very bad, then you obviously have to go for the operation, which is the conservative part is when if they see that your injury ain't that bad, so they will, rather than the surgery, you just move on to the rehab part, or you can just go in for the treatments or surgical treatments if it's proper bad.
Degree of posterior cruciate ligament injury. It's graded from 1 to 3. Obviously 3 being the most severe. Grade 1 is a partial tear, which is just a few strands being torn. And grade 2 is isolated tear. So that could mean that's the complete tear. That's grade 2, and then in grade 3 that includes the other ligaments around it. So say for example the ACL, LCL, and the MCL, they could also tear as well. It's a grade 3 PCL injury. Rehabilitation phase.
The rehab phase is sometimes split into four phases. The first one would be immediately after the injury. This is the part where the doctor, if you have a surgery, they'll tell you to go home, and for the first 48 hours, you shouldn't do anything at all. You should be in bed rest. You would apply cold therapy, and you try and see if you could do pain-free stretching exercises. So just little bit stuff that wouldn't put anyone in pain or anything, and strengthening exercises as well, but pain-free again.
Phase 2. After the first 2 weeks of phase 1, the plan is to eliminate any swelling, apply cold therapy, compressions, mobility exercises, using pain-free stretching exercises, and strengthening exercises, continuing from phase 1.
Phase 3. By this stage you might get your full strength back. You'll still be applying cold therapy, which is probably about like, now this time you would probably do like 3 times a day, which like about phase 1 you did it every 2-3 hours. You still be doing stretching exercises and strengthening exercises, but this will be, the intensity will be increased more. So you can start running or doing your bike training and stuff like that. That doesn't put that much pressure on that knee.
Phase 4, this is after 6 weeks, so this is the last 2 weeks of your rehab. So you basically return back to full training. You focus more on flexibility training. Sports massage can also be applied around the surrounding muscles to help build stability. And near to normal sprinting speed, so you try and get back to your normal sprinting speed, if you know what I'm trying to say.
Okay.
That's it.
Thank you. Well done for that. Just a quick question then. Can you just go back to that last slide? So, if you had a complete rupture of your PCL and you had your surgery, do you think you could be back sprinting within 6 weeks?
But this is more for like, probably for like more grade 1, but like if it's the more severe it is, obviously the more duration you have. Like in phase 1 you won't have it.
Okay, so what is this related to?
This is more like grade 1, grade 2.
All right. So great, but on your thing, grade 2. What? You go back to your grade 2. Sorry.
Grade 2 is complete rupture of the PCL.
Okay, so even with a grade 2, you could be back sprinting within 6 weeks.
No, that was more of like grade 1 into grade 2. If it's obviously you won't exactly move back in. Like if it's still bad, then you take more time going through the easy part.
So would you say that your rehab program was for more a grade 1 then?
Yeah.
Okay, that's all I wanted to know. Alright, thank you.